Good morning and welcome to the overview of the Bridge to Recovery Budget and Policy Ask for the California Association of Adult Day Services. I'm Becky Duffy. I'm the Executive Director of CADS, and I'm so grateful that you're all here today to see this presentation. First, next slide. I wanted to go over the agenda for this morning. We will be having a message from our CADS president. We're going to be introducing our 2022 super exciting state budget campaign, give an overview of the state budget and process, and some of the grassroots and communication work that needs to happen behind the scenes to make this happen, and what you can do to help. We will be having a Q&A at the very end of the session. And so I'm asking that if you have questions, if you could please type them in the question box, and we will be addressing them at the end of the session. Next slide. So the presenters for today are myself, Daniel Gallagher, the CADS Board President, Richard Lee, Jason Thielander, Christina Bass-Hamilton of KBH Advocacy, Maureen Irwin, and Renee Nashtet. And I just really want to give a warm thank you to all their work and all their help and how they've been supporting CADS behind the scenes in this huge campaign. Next slide. I'd like to now introduce Dan Gallagher, the incoming 2022 CADS Board President, to give a message to you all. Thank you, Dan.
Good morning, everyone, and welcome. As we begin this webinar, I'd like us to reflect on the myriad of challenges our center teams and participants and their families and their caregivers face during this unprecedented time of the last 2 years, and acknowledge the efforts you all have brought forth meeting these challenges as we navigate through the pandemic. However, before we do that, I'd like to recognize and commend the phenomenal leadership of the Vision team, the CADS and ALE teams, Becky, Pam, and Danielle, and leadership, and our CDA and CBAS colleagues in this effort with their all hands on deck approach to problem solving and the wonderful offers of assistance from many of you. And in particular, I want to acknowledge Lydia Missilides for her staunch leadership of the crisis and the Vision teams these past 2 years. I'm also going to touch on the All Facilities Letter 20.34.5, which was recently released last week, and hope to provide a little bit of clarity. The directive's language is rather difficult and ambiguous, to say the least, but there are a couple of concrete takeaways. The Vision team is working closely with CDA and CBAS to provide a workable framework in an effort to move forward towards regular operations. And Richard Lee will discuss that more in detail. But first, let me remind us of the challenges we've all faced since March 2020 with the stay-at-home orders. As you can see here from the slide, and I'm sure there's even more challenges than I am listing here, but initially we had the closure and suspension of services and our emergency responses to keep participants engaged and connected and healthy. Many of us pivoted to telehealth and virtual services as soon as we possibly could and enhance those services through some innovative practices. We've created a hybrid model of services, both with our telehealth and virtual services, and now providing a limited number of in-center services. I think many of us at some point in time had a loss of revenue of our centers, and certainly we've incurred a lot of expenses as we reopened our centers this last year for just a myriad of things, mitigation efforts, whether that was to buy personal protective equipment or air filtration systems or barriers, anything that we could do to help keep physical distancing and other safe handling methods throughout our centers to welcome people back, our participants back, in order to serve them safely. We've all went through an adjustment of our staffing, at least initially, and then as we move forward in reopening our centers, we had to adjust staffing again. Certainly our adherence to changing and confusing regulatory guidance, which seemingly change, weekly, sometimes even more than that. Just a roller coaster ride of adhering to guidance throughout the pandemic. I'm sure most of us created a living COVID-19 safety procedures and updated those. It's living because we've updated those numerous times throughout the pandemic to keep our staff and our participants safe. Many of us have reopened our centers to limited in-center services and the challenges that we continue to face with that, especially while we are still in the midst of a pandemic. We've expanded our mitigation efforts. We've adjusted staffing, again, as I mentioned. And we know as we bring our participants back into centers, coordinating transportation with our transportation affiliates has presented a pretty large challenge. And as we prepare to resume congregate care amidst changing guidelines, there are still quite a few challenges in front of us. Next slide, please. And here is these are pictures of some of our centers that have reopened and that are serving folks inside the centers now. You can see where our staff are wearing personal protection equipment and our participants are masked. We're still adhering to physical distancing requirements. So these pictures just illustrate just the efforts that you've all made to start serving participants in the center. We all believe that the best way to serve our participants is in person. We all want to do that, but we also want to make sure that we can do this safely to keep our participants healthy and our staff healthy. So next slide, please. So I want to acknowledge that the all facilities letter 20.34.5 that was released just last week on February 8th is rather confusing. But what it does do very concretely, it states that the temporary licensing regulations waiver that we enjoyed through CDPH expires on March 31, 2022. And by that time, staff teams are required to be available to provide services at the center by April 1st. So this guidance is incomplete. We are still trying to understand what the impact on temporary alternative services will be, and we hope to have that clarified by the California Department of Aging with the CDA ACL soon. And the Vision team is working with CDA and CBAS as we speak to hopefully create a framework for that ACL. Adult Day Healthcare Centers should continue planning for a safe and orderly return to regular operations as local conditions allow by April 1st. I want to make that clear. What this AFL asks us to do is to refer to the All Facilities Letter 2135 for guidance on in-center operations. And so if you've looked at the All Facilities Letter, which I'm sure you all have, the 2034.5, you'll see the link to the All Facilities Letter 2135. And just briefly, please refer to that as it gives guidance to reopen our centers safely by April 1. Again, this is confusing guidance because if you read through AFL 2135, it does list a number of activities that we are currently, for those of us that are providing in-center services, are currently following. So, but please refamiliarize yourself with the All Facilities Letter 21-35 and follow those guidelines per the recent AFL. Confusing, yes, but again, we hope to have some clarity as we move towards working as the vision team continues to work with CDA and CVAS. I'm sure there are quite a few questions regarding this, and we just ask that you hold your questions until the end of the webinar. There'll be time for questions and answers. Thank you.
Thanks, Ed. I'll take the next slide with the vision team. I just wanted to spend a little bit of time explaining what the vision team was and what our process is at this time. It gets mentioned very often, but we wanted to explain that the vision team is kind of the ad hoc group of providers and also leaders at CDA that have kind of gotten together since the beginning of the pandemic. Dan mentioned beginning, meaning March 2020, which was a long time ago for everybody now. But at that time, we were the crisis team and we were dealing with many of the structural changes to the program, as well as dealing with the elimination that we potentially could have gone through in the budget season. And so when we're talking about the vision team, we're talking about the volunteer members of the CADS providers, ALE, as well as the CDA leadership team that have been working toward this common goal of clarifying documentation, clarifying processes, and clarifying the ways that centers are supposed to operate in this very difficult season. I think everybody at CDA, at the vision team, and also providers all understand the nature of kind of the times of having to reopen and reclose and kind of go through this back and forth. But we want to make sure that everybody is headed in the right direction of reopening, and the vision team is constantly working together to be able to do that. The vision team has been meeting every Monday since March 2020. These are all solely volunteer hours, and this is just hundreds of hours put together by each individual that has really volunteered their time to put forth, tasks, put forth recongregation, put forth hours into making sure that ADHC, ADP, and all these adult services stay at the forefront and stay at, the tip of everybody's minds. And so we want to make sure and give credit to the team that has really put in countless hours to be able to do that. The web talks that Lydia led throughout the pandemic between May and October, May 2020 to October 2021, was provided by a grant from the Archstone Foundation, and that really put together the foundation of how to implement tasks, how to really get through these challenges that we're all facing. The vision team is going to continue to work on the preparation to return to congregate services. We know that this has been a process since July of 2021, and that every center should be moving toward congregate services in a safe way possible. But obviously, this has been delayed by the Delta variant and the Omicron variant most recently. We want to make sure that all the centers are moving in that direction. And of course, we couldn't do that without the help from CDA and guidance. But again, like Dan mentioned as well, there's a lot of unclear details as to how to move forward right now, but we are currently working, and Vision Team and CDA, we know, are currently working to do that. And also the members of the Vision Team, members of CDA, and everybody at CADS is going to help continue to provide centers with operational guidance. I do want to kind of convey that this isn't possible without kind of the participation of all centers, and all hands being on deck. And I know Renee is going to mention this later, but we do need to make sure that all centers, or all centers, are considering joining CADS and being part of CADS to be able to allow for us to have, and allow for our industry to have the time and resources to be able to provide this operational guidance, and also maintain relevance, and also make sure that we have the advocacy necessary to keep moving forward. And so with that, I wanted to turn it over to Becky to continue the issue of budget.
Thanks, Richard. So I wanted to talk a little bit about the proposed 2022 budget, and just to say that if there was ever a time for CADS to make an ask for additional funding to help centers return safely, now is the time. There's a surplus of 45.7 billion, and we have a huge opportunity this year to do good work and to help staff centers. Next slide. So there's also a surplus, and 86% of the discretionary surplus will be for one-time investments, which you'll find out later is part of the work that CADS is working on to get some of this funding. And so it is an exciting time, and I just want to stress that it was not enough in 2020 that centers were told, okay, you're not defunded. And last year we were told, just because you weren't defunded, that should be enough for you. That's never enough. So we're making a huge advocacy effort this year to change that. Next slide. So we've been working hard on our proposal for a legislative ask and policy ask to the Bridge to Recovery, which is really to help centers return to service safely and to help centers make those necessary accommodations that they do, so seniors don't have to stay in isolation, so they can return to center safely. So there's ways to harden the centers, so there's ways to allow for social distancing, and we're working with assembly members, the governor's office, California Department of Public Health, California Department of Aging, multiple members of the legislature to get them to back our ask this year. I'd now like to hand it over to Christina Bass Hamilton to cover a little bit more.
Oh, it's Maureen here. Does everybody see me? Okay, I am going to go ahead and we're going to talk about the grassroots program. Christina, I see you too, and if you want to go ahead and start with an overview, and then I'll get into the grassroots program.
Great, thank you. Okay, so nope, we got to go back a little bit, please. Back to, there you go. Okay, hi everybody. My name is Christina Bass Hamilton. I am a consultant for CADS. I'm a contract lobbyist and political legislative consultant. I work here in Sacramento, and I'm very involved in what's happening in the Capitol and basically trying to give guidance and assistance to the CADS team as they prepare to move this proposal and campaign forward. So taking a step back, I want to acknowledge first off, and I have been in the long-term care arena for a long time. I actually worked with Lydia for many years on issues relating to the master plan for aging. So I'm well familiar that adult day services have in the past been, constantly under threat of elimination because sadly, a lot of these lawmakers and decision makers, especially the governor level, Governor Brown and Governor Newsom, haven't understood how important these services and these programs are for our most frail and vulnerable elders in the community. And so we have been mostly in a defensive posture for years, preventing cuts and preventing the programs from being eliminated, most recently in 2020. However, since 2020, a number of things have happened. Number one, it was very unexpected, but the state started collecting historic levels of revenue that not only took it from it being proposed to eliminate adult day services and all of these other program cuts, within 6 months, the state was collecting way above projections in terms of revenue and was able to pivot from defensive to starting to actually make investments in services for seniors, people with disabilities, low-income Californians, et cetera. And so within the last year, the fiscal shape of the state has changed dramatically. And that has given us an opportunity to move from our own defensive posture and our own, what we've been calling scarcity mindset, that, we're just happy we didn't get eliminated, to, wait a minute, we want to take advantage of all of this excess, as every other organization out there that represents different constituencies is doing. We want to have a piece of this pie too, because we know that our members and our facilities are struggling, especially with the pandemic, for all the reasons that were cited just now, that the facilities are not in the position that they need to be in fiscally to take on all of the mitigation and all of the extra work that has resulted from COVID. And so in talking with Becky back in the fall, we decided we are going to make a claim, and in that process, we are going to educate lawmakers. We're going to educate the governor on how these are services that aren't just, not a big deal. They're life-saving, and they're that important. Before, however, we go into what we're proposing in terms of this grant program, I do want to address the issue of rates, because we know that that is front and center in your minds. And let's just identify the elephant in the room. Is the best thing possible to increase the rates? Yes, 100%. And let's be clear that that's something that CADS has been working on for years, hours and thousands of hours of work around the issue of how the rates are not enough to pay for the services that you provide. And there's a host of reasons why it is very complicated and not a simple question of, let's just ask the governor to increase rates. It doesn't work that way. There's the managed care plans that are actually the ones who set the rates for the CBAS. There's all sorts of intricacies in terms of the financing between Medi-Cal and Medicare, and none of those present an easy one way to just increase the rates for everyone. And I'm saying this because I don't want folks to say, well, why are we doing, mitigation grants? Why aren't we just increasing rates? The struggle to increase rates is very complex, and it's a very difficult, challenging process because there's a lot of different characters involved. And really our number one issue is convincing the managed care plans as a whole that they need to pay more and that they need to value these services more because of their bottom line. There's the conflict between Medicaid and Medicare, and which system assumes the cost of these services. We won't get into that. What we want to acknowledge is, yes, that is a big problem, and CADS is committed to working and solving this problem, but it is a long-term campaign to do that. And I'll be very honest with you, I work every day at the Capitol in Sacramento, doing the type of changes that we're talking about, increasing rates, that is, you need a team, an army of people every day at the Capitol talking with the administration, with lawmakers, with the managed care plans, with the Department of Managed Care, with the Department of Healthcare Services. That will never be accomplished unless CADS can bring an army of advocates just working on that full time. And I'm going to be honest with you, why are schools getting increased funding? Why are hospitals getting increased funding? Why are nursing homes getting things? The point is, it's the teams and the armies that they have on staff, on availability, that can help them push and get their influence and get what they want. This is politics after all. We have to be clear. The squeaky wheel gets the grease. And it's time for us at CADS to start being a squeaky wheel. And this is the first step to building that. So moving on to the next step. We are proposing that the state take some of this surplus dollars and do a one-time creation, allocating 30 million-ish. We're actually still working out exactly how much money we need based on the surveys that you all recently completed, but at least 30 million to create a new grant program that would fund mitigation and resilience grants straight to facilities to allow you to do all of the work that you need to do on your infrastructure, on your facilities, in order to resume congregate in-person services as soon as possible. And the key here is that it's one time, because there's all sorts of politics and complications around ongoing spending. We believe politically and just in terms of the complexities of the state budget, there's this spending limit that the state has to account for, which actually motivates them to do money around infrastructure. So taking into account all of the factors, we believe that this is the best chance that we have to win funding to be able to put money into your facilities immediately. Next slide. So very quickly, this is what we are proposing. Grants would range from 10,000 to 200,000 for renovations, repairs, modernization, retrofitting of the facilities, or to reimburse unanticipated costs that you had doing these things resulting from the pandemic in the past, and for other health and safety or licensure needs to make the facilities, we're very much using the words hardening the facilities and allowing them to be more resilient for future emergencies. We know that natural disasters continue to be a thing that is not going away, unfortunately. We know that COVID will not likely go away for years, and that we need to move into how do we live with it, and how do we live with it safely, and how do your clients come into congregate settings living with this reality. Next slide. So the good news is we have secured a champion for our legislative requests. And to be clear, actually, hopefully later today or tomorrow, we will have a bill number. It is being introduced today in the California legislature by Assembly Member Lisa Calderon. She represents the Whittier area in Los Angeles County. She is our bill author. She will also be our champion for the money, the actual budget request. So we have a bill which has the policy of what the grant program would look like, and then we actually need the money. And the money is through a request for funding, and that happens through the separate budget process. The two dates that we want you to note on your calendar now is March 3rd and March 23rd. There will be hearings specifically on funding for the California Department of Aging, where we are proposing that these grants be housed. And so we will be calling on you those days when the hearings are happening to do public comment and to say, yes, we support, 30+ million to create the Bridge to Recovery grant program. But we will give you more information on that. We just want you to save the dates, and we will give you instructions on how you do all of that. Next slide, please. Okay, so it's my pleasure to pass it over to Mo Irwin, the CADS PR consultant.
Thank you so much, Christina. It's great to work with you folks again. Some of you may remember in 2020, we worked together on the May Revise campaign, which we had a tremendous amount of success due in extraordinary part to your participation. So this year we're going to be doing something, the campaign's a little bit different, the issue's different, but we're going to be using many of the same tools and techniques that we used in 2020, and I'm just going to spend the next couple of minutes familiarizing folks with kind of the who, what, where, and how we're going to roll this campaign out and how you can participate. Next slide. So using all available and effective media and communication tools, we're going to target legislators with consistent and compelling messaging, making the case for this funding for the COVID mitigation program. And just to reiterate what Christina already went over and said really, really well, we have to do this because we are competing for their time. We have legislators that have, even in a normal year without emergencies like COVID and fires, there's so many things that they need to be paying attention to. Their business interest groups constantly at their door. So we've really got to try to break through that noise. And we have some legislators, for example, Calderon, who are going to be asking her colleagues for support. And it's really our job and the center's job and the folks on the phone, all our job to help her be more effective in her work. So when she's asking other folks to sign on to this, they will have heard from us. They'll know what the issue is. They'll be familiar with it. So she's our champion, and it's our job to make her job easier. And that's what we're going to do through this program. Next slide. So our guiding principles, same as last time. When we're doing these communications to the legislators and we're making our case, a few things to keep in mind. We want simplicity of our messaging and consistency, and we're going to help you. With that. Always remembering that people and photos and stories are more engaging than text and a bunch of, numbers and data, right? We want to help them remember our message. Number 3, we're going to stick with our messages and we're going to avoid distraction. So while we're talking about this budget request, there are other issues that relate to adult day services in our centers. We're going to put those aside for now, and we're going to focus just on these messages. Number 4, we're going to avoid jargon and abbreviations. We have to remember that the state legislators, they may be familiar with Adult Day, they may not be, so just try to be really simple in your communication with them. We can't assume that they know what all of these different programs are and what their abbreviations are and so forth, so keeping it simple. And then of course, staying out of the weeds, avoid just going into way too much detail on a certain issue or item that we want to talk about. And then, just again, keeping it really simple and just direct and to the point. And again, we're going to help you do all of that. Next slide. Okay, so what are our messages? So what we're going to be doing is, again, telling these legislators a story. And what we're going to basically be doing is starting off with sort of who we are, what happened, how we got here, and what the solution is. So basically, community-based adult services, adult day centers, we support community living for people who are low income, vulnerable seniors, and people with disabilities to avoid nursing homes and costly hospital visits. To keep participants safe and healthy during the pandemic, in-center services have been limited. Remotely, teams conduct weekly wellness checks and health assessments, deliver meals and vital supplies such as masks, conduct online activities, arrange for vaccinations, and many other services. Now remember, a lot of our legislators, they don't even know what we've been doing during during this time, right? Maybe they think all the centers have been closed and there's actually been nothing going on, right? So we need to tell them we've been continuing to serve our folks and be out there and providing these services in a different way. So again, remind them of what we've been doing, but also remind them, even with this intensive person-centered support, 2 years of social isolation have taken a tremendous emotional and physical toll on participants and caregivers. And that's something I think that they'll be able to understand once they hear what we've been doing. Now, COVID isn't going away, but there is a way to get back together safely in centers. And by fortifying them with evidence-based ventilation improvements, expanded, repurposed outdoor space, heightened critical infection control measures, testing, masking, centers can reduce the risk of transmission. And of course, given all the awareness around how other places, for example, schools, other places are basically, having to make adjustments to keep people safe and provide for distancing, this will make sense, right? So we need to help them understand our folks have not been in our centers very much. To get them back, we need to make sure it's being done safely. Next slide. So Christina, do you want to, I'll hand it back over to you, and then I'll get back a little bit into the tools that we're going to use. And
yes. Oh, sorry about that. Yes, thank you, Mo. Sorry, I jumped in too quick. Yes, how do we win, everybody? So this is about communicating, as Mo just said, the stories of the clients and the families. That is what moves these lawmakers to action. And so exactly what she said, our job is to make it easier for the assembly member to get the votes that she needs to pass this into law, right? And how do we do that? We start by contacting your representatives, okay? Because who do they care about most? Their constituents. So we start with identifying who is your representative. There's going to be senators, there's going to be assembly members, and reaching out to them, reaching out to the governor's office through emails and through phone calls and other ways that we are going to connect you to engage with them. Specifically things like meeting with your legislator in the district. And one great idea that you can start with right away today, and if you need help, let us know and we'll help walk you through it. Identify who your representative is and invite them to come visit your center. Whatever that looks like to you, bring them in so they can see with their own eyes the services and the value that you provide to the community. A lot of these folks have no idea, and it's really theoretical to them. They'll see it, they'll read about it, they're like, well, that sounds nice. Okay, but maybe there's other priorities that are more important. We want to connect them visually, emotionally to the work that you're doing, and the best way to do that is to have them come and witness with their own two eyes the miracles that you provide every day. So we want to empower you right now, today, tomorrow, next week, whenever you can. You call the district office of your representative and say, I am a constituent and I want to formally invite my representative to come visit the facility so I can introduce them to who we are and we can let you know what we do and meet our clients, whatever works for you, okay? So we're going to be doing targeted outreach. We're going to be promoting communications, and we are also going to engage with you to do lobby visits. Again, we can do them via Zoom. We can also do them in the districts with your representative so that you can say, this is what I want you to do. Next slide. So targets, as I mentioned, the governor clearly, because we need him to approve all of this. What we call leadership in the Capitol is the Assembly Speaker. He is the leader of the Assembly, and that is Anthony Rendon out of LA County. We have the Senate President Pro Tem, which is the leader in the state Senate. Her name is Toni Atkins. She's based out of San Diego. We have the budget committees, the chairs and the members, and we have the policy committees that would be hearing our bill, also the chair and the members. we're targeting them because these are the immediate people that we need to start agreeing with what we're doing, specifically these committee members, because they will actually vote. And so what we're going to do is be very clear. We're hitting these people first because we need them first. Then we're going to move on to the next set of people. And so what's important, what the CADS team is doing is actually looking at a map and identifying which facilities are in which districts, because believe it or not, if you live in Tony Atkins district, we will be calling on you to specifically reach out to her as a constituent because she is very important and very influential. So based on where you are, yes, your representative is important no matter what. Some happen to be actually more important. Moving on, next slide. And as Mo said, I'll just reiterate, stories are the most important thing. Research shows that people remember the story before they remember the facts and the figures and just talk, right? So we want to have you start collecting stories, talking to family members who are willing to share their story, and really start creating a database and a list of like, here are the most compelling stories within our community, and we're getting them ready to start kind of putting them out there. Next slide. Okay, and I'll pass on to Mo.
Great. Well, thanks again, Christina. Again, telling these stories, as she just said, is going to be really, really important. And we're going to be making phone calls. We're going to be sending emails. We're also going to have a social media component. And we are going to need to have, again, pictures of folks, videos if you can, capturing them in the center, sort of what's going on to help us tell our stories. So again, if you can start identifying folks who would be open to, having their picture taken and signing a release, doing some of these activities, just like the one that you see in the slide, these are the type of pictures that we're going to use to tell our story. And although social media is not going to be the first and highest most important ask, it's going to be the phone calls and the emails, it's still going to be important. So for those of you who, for this is your thing, you're on social media and you can provide us with some good pictures, please start taking those and sending those into us. And throughout the campaign, those will be used to help tell our story. Next slide. Okay, so for those of you who were around in 2020, we had this great app. It was called Phone to Action. They've changed companies, but we're going to be using a different platform for you to be doing those group emails and group phone calls when we ask you to do that. So the way this is essentially going to work is we're going to be sending you out an alert probably about once a week with the targeted activity for that week. And that's going to change. For example, we have some hearings coming up, as Christina mentioned, in March on the 3rd and 23rd, where we're really going to need folks to call into those hearings. It's going to be really, really key. That week, we're going to want everyone focused on that. And to give you a little heads up on that, what it's potentially going to entail is calling in and sitting on the phone in a queue for a really long time and just having a very short snippet of time, a minute or two, to just say who you are and what you want them to support and why it's important really, really quickly. And the reason that's important is that when you make that call, all of those legislators in that committee are there. They're hearing you, they see each other hearing you, and they know that there are many, many hundreds of people trying to get through on the phone. And if only one or two people from CADS gets through, they know that there's probably an army behind them. So that's going to be really, really important. So there's going to be a couple of weeks when we're going to ask you to do that. Other weeks, we're going to ask you, we're going to direct you to our platform, and we're going to have you calling maybe a different committee, maybe your home legislators, whatever it is for that week. And as folks sign on to this legislature, the targets are going to change, right? If somebody has gone ahead and signed on, well, we're going to take them off that queue and maybe focus on somebody else. So what you're going to do every week is be landing via a text alert on a page that's going to tell you the activity for the week. And something that we would like folks to do right now that you can do to get yourself geared up is if everybody could go out and get their phone and open up your photo app. Okay, and there we go. And if you point it at the QR code on the page, let's see, that's the next slide. Here we go. pointed at that QR code, that should take you to a landing page. Yep, Christina's got it. And if everybody could just take a minute to go ahead and fill out that form, we'll give folks just a minute or so. Just you're putting in your name, your address, all of that stuff's gonna go into a database. And you're gonna be opting in to our text message alert. Christina just did it. And if you fill that in right now, and go ahead and just get all that information in there. Got it. And then you go ahead and enter that, submit it. And what that's going to do is you're going to be now in a queue for getting text alerts. So the minute we have everything ready to go and we have an action that we need folks to focus on for that week, you're going to get a text message. Yay, Christina did it. So you're going to get a text message for that week. You're going to land on our page, which is going to have the priority activity for the week. It's going to tell you how to do it and give you tips and instructions, and then we're just going to have you go. And again, for that first week, it may very well be signing up to make a call into a committee. Subsequent weeks, we may just have our platform up there where you just type in your name, address, you tell your short message, and you send an email, and boom, it'll go to all the legislators. Or you'll sign up to make calls, and you'll get a phone call back from a system that's going to cue you in to start calling these legislative offices. So the tools will be set up for you, but what we really need folks to do right now is just get on that page and just be looking for those text alerts. And when you get them, just know that the time is now. Hit that page and go for it. Next slide. And again, as we mentioned before, videos, participants, stories, and so forth. We're going to want you to be getting those too, so that we can, when we have a week where we want to focus on maybe social media, that we will have that ready to go. So again, we're just trying to get folks prepared and know sort of what to expect as we unroll this program. And again, this is the way we do it. We're going to, by implementing all of these tools and by getting our message out, we're going to drastically improve our chances of passing this, because again, we've got somebody in the legislature who's our champion and is picking this up and running with it. And all of these things we're doing are going to help her. And so we really want to help her, our champion, and get this done. And so, we can all get back together safely, just like we've been talking about. Next slide. Okay, Christina.
Okay, so really quickly, let's recap where we are. We have an opportunity that is right in front of us based on the revenue collections, based on the state needing to spend money on infrastructure, based on the COVID pandemic. We are in a position that this is possible. And so we have to grab this opportunity and run with it. So it's a big thing to do, though. Let's be clear. It's not like you just make your case and they're like, oh, okay, here's $30 million. It doesn't work that way. Everyone else is out there saying, I need money for this. I need money for that. The question is, can we make our case loudly, consistently, effectively, and then we keep going until the final budget vote happens and the governor signs it on June 30th. So this is between now and June 30th, everybody. We are just going to be hustling on and on and on and on, the best that we can, to continue to say our message, to repeat our stories, to make the case, and to drill for these votes, because there's several steps in the process. There's committee votes, they go to the floor, then they go to the other house. So we got to be on this process, and we got to make sure we don't let the ball drop. A lot of this is inside baseball, and that's why we have a team up here in Sacramento that is working and is experienced in how this process works. It's pretty dang complicated, but none of it will happen without you and without your work, all of the things that Mo just talked about. We cannot just do this in Sacramento. It has to be a layer effort everywhere, and especially in the local communities. Why? Because what these lawmakers care about is their constituents. That's it. So if if they're not hearing from their constituents that they need to vote for Bridge to Recovery, it's likely they won't, because they've got other constituents who are asking for other things. The squeaky wheel gets the grease in Sacramento. So we've got to be a squeaky wheel from now until June 30th. So if you have any questions, if you have ideas, let's start talking, reach out. We can help you make a request to your legislator. As we said, we can prep you for that. This is the beginning of the campaign, so there's a lot to do, and we look forward to continuing to work with you. Please reach out with questions and ideas. We're here to help.
Mo and Christina, thank you. I've been monitoring questions. That was a great background. We're a little ahead of our schedule, so I think it'd be a good opportunity now to ask a few questions that have come in from the webinar attendees. And one thing that I'm wondering, Christina and Mo, is how you feel about this one-time grant opportunity because of this one-time, maybe next year, we don't know yet, surplus versus ongoing spending. How this is an opportunity and a way to set the stage for next year and the year after and the year after when we ask for something that is ongoing funding, let's say, or we ask for some changes in legislation. Could you comment a little bit on that, building some momentum?
Yeah, that's a great question, Lydia. Here's the thing. In Sacramento, in the capital, every interest is out there trying to influence the process to get what they want. That is how government runs. So if you care about a sports team or housing or transportation, if you are someone who builds, rockets or whatever it is that you do, you have people in the Capitol representing you and your interests to make sure that they are not doing things that you don't want them to do and that they're doing things that you do want them to do. Adult Day Services is no different. So this is the beginning of a process of creating a presence in the Capitol long term so that they are aware of who you are all the time. And it cannot be once there's a budget cut, all of a sudden they hear from Adult Day Services. No, it has to be an ongoing presence that then builds momentum over time to start getting more and then more and then more. It's a multi-year effort, but this is the beginning. We can build on this step to start reaching higher heights. That's how it works in Sacramento.
Yeah, it would be so wonderful if we could waltz into a legislator's office and not have to start from ground zero. What is Adult Day Healthcare? What is an Adult Day program? Wouldn't it be nice if they already knew and understood? That's the goal, right? Make this a household word. And Mo, somebody is asking, actually, it's Diane is asking, for people who prefer email, how do you envision with Danielle and the CADS team communicating with people that aren't going to be able to get texts on their phone?
Yeah, great question. We will also be sending out email alerts as well. So for those of you who are already on the email list, we will send that out. The advantage of having a text is it just like pops up on your phone. So it'll just get there a little sooner, a little quicker, and direct you there. But we will definitely not leave you out if texting is not your preferred method of communication.
Great. And Mara just texted a message, a question, and I answered with yes. And her question was, does this initiative include Adult Day programs? Absolutely, 100% yes. So this is all Adult Day Services inclusive, and we know that many of you are struggling. The other question that came up that I'll answer quickly is the language right now that we've provided to Assemblymember Calderon is somewhat akin to a current law for childcare providers and facilities who have the opportunity to apply for grant funding to improve their spaces. So I feel like this is a wonderful sort of bookend of children last year and older adults this year. And I think that really helps with our messaging that there's a precedent for this and that your needs, your participants and caregivers' needs are equally as important. This is a vulnerable population. So yeah, thank you for those questions. Christina, you were part of the Master Plan for Aging LTSS committee, as was I. And there's a question here about the master plan for aging, how, you know, are there opportunities there? And maybe between you and I, we could also comment on the staffing, workforce rather, caregiving economy proposals that are out there, because that's something new that's coming down the road.
Yes, I realized we didn't hit that as part of our proposal, and that's really important also. The master plan for aging just provides another avenue to make the case for this, right? The way you make things happen is you talk to everybody who has some influence on the process, or especially on the governor. The master plan for aging process is important because that ultimately goes to the governor, all of those sort of communications. So we are making the case not only in the committees and in the actual legislature, but outside in the form of these master plan meetings and these all other venues. For example, the impact team or the vision team, I'm sorry. Every chance that we have an opportunity to be talking to these departments, agencies, everyone else, all of these people will feed back into the larger loop and basically be supporting and reiterating what we're trying to do. And actually, Lydia, why don't you hit the workforce piece, because I think that's important.
Yeah, so the federal spending plan that is in play right now has funding for the Department of Aging to provide one-time grants in the form of stipends or retention grants, things like that for CBAS and for the MSSP program in Department of Aging. In Department of Social Services, there's already a plan underway to provide stipends to IHSS workers. So all of you I know are familiar with the IHSS program because your participants use it. They are going to be getting checks in the mail right now, IHSS workers, from the Department of Social Services. So the Department of Aging's plan is still in development. We've provided some input to them based on the CADS Board of Directors priorities, and we expect that we'll see some kind of a plan for staff coming out in the next month or so. So there's something in motion there to help alleviate a little bit of strain with staff. We are all keenly aware of staffing shortages and the struggles you all are going through relative to keeping staff working and recruited and retained. So that's something that we are tracking very, very closely. There's also new opportunities coming along. Probably CADS needs to do another webinar on CalAIM and enhanced care coordination and some other opportunities there as well. Let's see. We had several questions about the 6-foot distancing. So I don't know if maybe Richard from Vision Team, you want to jump on and talk about 6-foot distancing and what we're hoping for there. The California Department of Public Health is in charge of guidance related to safety. And I know we've talked about this probably every single meeting, right, Richard, that we've had for the last year. Yeah, so would you mind kind of sharing some of the thoughts of the Vision Team about the 6-foot distancing and efforts that have been made by CDA?
Sure. I think just going back to what we know about physical distancing right now would be rooted in the last guidance from CDPH. I think it was 20.35, which was written in September of 2021. And we know it's a little bit outdated because it doesn't take into consideration Omicron and the current standard. But that's basically what we're held to at this point. And so it goes through, and I know each individual provider has probably read it like 100 times, but it says that you have to maintain distancing if there is anybody that is unvaccinated, and that you can remove the distancing and the masking for short periods for activities. But operationally, we know that this is extremely difficult. And if we try to reconcile that with how we have to operate our program currently with participants coming back, it's a huge challenge. And so I really want to be able to answer Lydia's question and everybody else's question of how we're supposed to be able to fit these things together. But I think each program is going to have to tailor their program to be able to fit with the current guidance. And of course, CDA is furiously working right now to be able to meet the demands of the current standpoint of having to bring people back by March 31st and having them return to congregate services and having the distancing at the same time. And so I think the answer is we'll see, as it always is at this point, but I think it's a work in progress, and this is something that's we know is of utmost importance because it needs to be solved before all centers can operate at full capacity or even half capacity, right? And so that would be something that's being considered right now.
Yeah, thank you for that, Richard. Wanted to bring in your voice as a program director to the conversation. There are a number of questions that Dan addressed early on related to, does this mean TAS ends March 31? That is the million-dollar question that remains unclear and unsaid in the Department of Public Health's recent all facilities letter. And the reason for that is because California Department of Public Health for CBAS programs, the licensing entity, only has jurisdiction over licensing regulations. Department of Healthcare Services, the single state agency for Medi-Cal, Medicaid, is responsible for payment and policy. So we know for a fact that Department of Aging is meeting with Department of Healthcare Services and the Department of Public Health, and it'll go up the chain of command from there to get you all clarification about what exactly this means relative to TAS. So I'm sorry we don't have answers today. Believe me, we're talking hours and hours weekly with the Department of Aging, and they are working furiously to get you some answers. So please sit tight, focus right now on the requirements in the AFL, which has to do with staffing, and guidance will be forthcoming to everyone relative to the rest of the current requirements around TAS. And it doesn't mean, as Dan said, though, that we shouldn't be all planning for how you're going to get participants back safely as local conditions permit. So that's the best we can do today. And I know there will be additional webinars from CDA, from CADS, and others to give you further guidance. Okay, so those were kind of the big themes that have come up in the questions. So let's go ahead now and turn things over to Renee and Jason, who are going to talk about what it's going to take to get all this stuff done. And Christina Mo, thank you very much.
Woo! Wow, guys, that was incredible, incredible. I'm in awe of Christina and Mo because they are able to speak a language that I'm not and connect with people that I'm not, which are the decision makers that we have. And here I am again, I'm selling raffle tickets. You guys might have missed me the last 2 years, but trusty me, I will come back because I'm reminded of something that was said by some of our legislators during our last elimination. And they, after testifying, they said to us, hey guys, how come we're only hearing from you when things are really bad, when you guys are under threat? And I can't say more eloquently or echo more what Mo and what Christina said so well. In order for us to be on the radar, in order for us to not only protect ourselves from future cuts, but for us to actually grow, make changes like rates and so forth, we need the army that other industries have. A lot of you call me and you tell me, Renee, how come, we see that these industries are getting, increases? How come these industries have, so much representation? They're not being eliminated. Well, it's because those industries have large armies. And I think if we haven't gotten it by now, what that means is that we are so much stronger as CADS, as the Association for Adult Day Services. We cannot do this on our own. We cannot do this with a group of 10 providers. We cannot do this with a group of 15 providers. We need to do this with our entire group of 267 providers. All of you each and every one of you, because the only way for us to make this work is for us to advocate every day. And I know you guys don't have time to do that. I know you guys are taking care of people. And so we need to have on our team, in our Army, people that are able to advocate for us every day and to make us visible to our legislators, to the governor's office, so we can push forth the things that we want to see in our future. And this is just one of those. This current ask that we're doing, that's sponsored by Assemblymember Calderon, this opportunity, we will only know about such opportunities if we have people that are looking out for opportunities for us as an industry. It's a lot easier to ask for money and to get changes made when there's a pot of money there that we can ask about. So yes, here I am again, asking you for money. I'm asking you for money for your future, for the future of your company, for the future of your participants. Right now, I'm asking you guys for donations to CADS, so we can have folks like Christina, like Mo, to do the work that they're doing. Right now, this particular ask is to secure all of these folks that are helping with us, that are going to help provide grants to help with transportation, workforce issues, all the stuff that we know are an issue for us. We know, you know, if you didn't listen to today's webinar in its entirety, or if you did, you probably realize that CADS and every single person here, all of the topics we've touched, it really should give you the confidence that CADS is in touch with your experiences, with your concerns, with the things that are important to you. And to push that forward to in the future, this new tool, how awesome to keep you guys up to date via text, to be able to communicate with your legislators. These things cost money. In order to build that army, we need money, okay? And we know the last couple years have been hard, but we also know that the last couple years have also given us some financial abilities, and we need to right now invest in our future. Invest in a future where we can see this industry grow, as we all know that it should. Your membership is important. For those of you that are not members, I cannot talk anymore about that. So before I keep on going, right now, I'm going to ask for a volunteer, one person, at least somebody to start me off. Otherwise, I'm just going to tell you, I'm going to get fired from this job. You're not going to see me next time on the next webinar asking for money. I want somebody to put in the question box right now that they are going to make a donation to CADS. I will make you famous. I will call you out on this webinar, but we need your commitment. We need your commitment. We need you guys to let us know that you are, oh my gosh. Kathleen Pineda from Home Avenue is donating $1,000 to CADS. That is amazing. This is what we need, guys. We need you, not only on the phone, but when you can't be on the phone with your legislators, you need to know that somebody's on the phone for you. Heck yeah, Daily, Oxnard Family Circle, Katie, they're going to be making a donation. $5,000 from Sunny Day, Adult Day Healthcare. Lovejoy, $1,000 from Helen from Lovejoy. Thank you so much. IAS from Ventura County ADHC is going to send $1,000. $2,000 from New Sunrise. You guys, well, obviously you either really like me and want me to keep my job selling raffle tickets at future CADS conferences. I do appreciate that very much. I know that there is 196, no, there's more, 100. There was 200 people on this webinar. I know that. And so I know I don't only have 6 or 7 here donations. I appreciate what you guys are doing. We have already had donations from some of these amazing folks from Orange County Adult Day Healthcare Services Coalition and Kay, from Daily at Sunny Day, Helping Hands from Better Living, Dr. Tatum, Richard. These people are not only putting in their time, they're also putting in their funds. And that's really what this comes down to. We need all the funds that we can get so we can advance your causes. And if you want to know where your money is going, get on the board, join, call. It is up to you. ultimately, if you feel like your messages aren't heard, then become a part of the messaging. Add your voice. Hell yeah, Loving Care, $1,000. Rachel, they're going to be donating $1,000, 1,000 donation from Lakeview. Coastside Adult Day Healthcare, 1,000. Fresno Seabass. You guys, this is warming my heart, because what it tells me is that you believe in what you're doing, you believe in what we're doing, and you realize that we are much, much stronger together as a team, as an industry. 267 centers. I want to see all 267 as members of CADS. A lot of you guys call me. A lot of you guys call me and you tell me about what can we do? What can we do? What can we do? I get it. Best Seabass, Gergen, thank you. They're also going to be making a donation to CADS. Keep them coming. Keep them coming. $1,000 from Altamedics. Thank you, Altamedics and Sergey. You guys are what is going to make this happen. This is payment into your future. This is your insurance policy. If you want people like your participants to continue to enjoy this program and you want to be able to continue to provide it, you have to help build the Army. We are the Army. And a lot of us are very loud, and we're here and we're meeting, and there's tons of countless volunteer hours. But there are folks that we need to pay for, technology that we need to pay for, so we can do this. Thank you, Don Myers, for a personal donation. Thank you, Don. That's incredible. Personal donation from Don. And you know what? I mean, this is like, you know, last time we did this, I made personal donations, and I'm kind of ad-libbing right now. My wife may kill me, but I'm going to say this. If somebody wants to, I need the next person to tell me that they're going to give us money. So if somebody is going, I'm going to match somebody's $1,000 if they want to. Next person that puts down $1,000, I'm going to personally match it. Not TurboTart. Renee's going to match it. It's going out of my alcohol fund. So you know it's very important for me. So somebody's got to give. That next $1,000 donation, if we get it, I'm going to match it. So guys, please, please, please. Oh shoot, Armene doesn't want me to, oh my God, a lot of people don't want me to drink. Armene doesn't want me to drink. She's donating 1,000. I'm gonna match it. 2,000 from Grace. Thank you, Manuch. You guys, when we do this, all the money that you donate, you're gonna get it back tenfold because of what the Army is going to do for us. This is not in a way optional. This is our future. This is our future. So again, I hope that one day I'll be able to actually sell raffle tickets to, oh my God, Among Friends, Mark Kovalik, 1,000. Thank you, Mark. Mark, these are people, I miss you guys. When I see all of your names popping up here in the question box that are, you know, telling me who is donating and who's supporting this, it makes me miss you. I miss you guys because it's been so long since I've seen you. But what's most important, you know, out of the last 2 years, even though we haven't seen each other face to face, I want you to know, and you do know, how many webinars have we had? How many times have we communicated together? $1,000 from Calabria Care. Thank you, Jill Wood. Mountain View ADHC, $1,000. You guys are kick butt. Guardian Angels, $1,000. You guys, it's beautiful, even though I don't get to see your faces. It is amazing to be able to see that you care about this industry and that we can do this together. I know we can. You know, when Christina was talking about how this is done in real life, it gave me goosebumps because I can't talk to the folks that Christina's talking to, but she can, and she can round folks up that can. Mo, finding the ways in which we can talk to people. Heck yeah, Valley ADHC in Fresno is making a donation too, and personally, $1,000 from Circle of Friends. AmeriCare, holy oh my gosh, oh, I almost said a bad word. My mom, Irene Nashstead, $1,000 from AmeriCare. This is great. Can you imagine if we could get all 267 centers here? Oh man. Okay. Oh my God. Nell Pineda. My mom just donated 500 and 1,000 from her husband Ramon. Ramon wants to keep Nell happy, so this is very good. So get your family and friends if they care about what you do. This is of the utmost importance. Let's build our army forever, so we don't have to meet on these events. We don't have to have a repeat of 2020. So we can continue the work that we do. So we can continue to have Christina, so we can continue to have Mo, and we can have more people. So ADHD advocacy is a daily thing. So people in the Capitol know our names. So the governor doesn't have to guess what we do and create legislation that doesn't look and take us into account. Somebody's got to cut me off because I will keep on talking. Oh, where do you send? Oh, Nancy Keegan. Thank you, Nancy. A personal donation of $100. Where do you send your checks? Okay, so I'm going to hand it over to somebody from CADS that can give us an answer on where to send your checks. Really cool things. I'm just going to tell you at the end of this webinar at some point, there's takeaways. The takeaways are we're going to know what bill number we have. Horizons ADHC, bravo, $1,000 from Horizons ADHC. Thank you, Horizons. Edward from Valley ADHC. I mean, this is fantastic. Guys, the takeaways are we're going to have an army already on our phone, thanks to Mo. We're going to have bill numbers. We are going to be a constant voice and a constant face. All right. Okay, I'm getting a message right now on where it's not, as I will send invoices to all that have pledged. So good job. So CADS is going to remind you that you pledged money and they're going to send you an invoice. Danielle is going to do it. So, or Pam, just joking. Pam's going to do it. So you don't have to remember. She's going to remember. She's going to save this chat and we're going to thank you. And I sincerely hope that, that we're going to get to see one another face to face. So we, can continue the work that we do. And we're going to see each other so often. We have a deadline looming. We have about a month and a half. And so we're going to be talking a lot more. Thank you guys for all the love to CADS. This is my heart. I am going to now pass off the slide to Jason, J-Dog, J-Dizzle, who is our board member. I'm sorry about what I just did to your name.
That'll work. No, thanks, Renee. As Renee's saying, we need an army, and advocacy is not a short-term commitment. And we need your support to ensure the success of the 2022 state budget campaign and beyond. It took me a while to understand that. I think, like a lot of you on the call, for a long time, I would go on these webinars. I would send in a check. I would make maybe 1 or 2 phone calls. And kind of consider that I did my my due diligence for my self-advocacy work for the year. But a few years ago, something changed for me, and I became a full-time advocate. And it feels like a daunting effort, so I encouraged others to join me in the effort. And it took some time. This isn't an overnight activity. You don't just become an advocate and then everybody follows you. So it took some time and some effort. But before long, I'd say about maybe a year, 18 months, I had a core group of 4 or 5 individuals who receive services from the organization I'm a part of, VTC Enterprises. And they're always available now to get on a phone call with me, to make a legislative visit, to speak at an event, at a Rotary, at a chamber function, attend a meeting, or provide a tour, because really this is sort of an overwhelming thing. We all said we're very, very busy people. So to take this all on is too much. So if you can, divide and conquer. And at this point, when a staff member from a legislator's office wants a tour, I've got 2 or 3 people that give better tours than I ever could. I pair them up right away and off they go and do the tour. So I really encourage you to connect with those individuals you serve and other staff members to see who would be interested in participating in kind of creating a self-advocate group, in making public comments at legislative hearings, and having direct meetings with elected officials. Because I got to tell you, there's such a difference You know, we had some legislative meetings this past year. They've all been virtual for basically the last, 2 years or so. But at this point, it's wonderful to get on a call and a staff member will say, "Hey, where's so and so?" because they saw them at the last meeting a year ago, and they'll remember. So that's such a different meeting when you're kind of connecting with one another at the beginning of the call, as opposed to introducing all your asks and all these other pieces. They just get to talk to the person and be like, "Hey, how are you doing?" And that's just this wonderful connection that's been able to be created. So given the current state of the remodeling at the Capitol also, virtual legislative visits are super easy. This isn't, getting vehicles and planes and renting cars and getting people to the Capitol. This really is making sure people have good Wi-Fi connections and a decent camera and a microphone and a computer, and they can get on and join these virtual meetings. So again, I encourage you to take that next step and become a full-time advocate. You can still do your full-time job and do this. I've done it for a while. It's not mutually exclusive. Are you going to make mistakes when you're taking the lead on some of these calls with elected officials? Sure, you're going to misspeak, but you're not a professional lobbyist. We have other people on this call that are. They're much more eloquent than I am. It's okay. You're being polite. You're expressing your concerns. You're a constituent. So again, I encourage you to just take that next step and become a full-time advocate. So I think at this point, I'm turning it back over to questions, correct?
Yeah, Jason, this is Lydia. I am going to pledge $500 from my personal pocket, and I will match anyone, or I will put that up as a match for anyone that right now is able to donate $500 to the cause, and that'll come out of my pocketbook. I haven't told my husband this, but he supports y'all. We'll duke it out here. So I'll match a $500 donation right now from any of you who want to do that. Avanitas, Rose Kleiner, thank you, Nancy. Okay, thank you. So there's $1,000 right there, Renee, to put into the hopper. And
keep going, guys. Don't let it stop now. Just because, I stopped asking you and begging you, it's not over. Jason, it's not over. This is a lifelong effort, and it's going to pay off. All of this pays off every single day. You can thank CADS for an ALE for all of this last 2 years, for tasks, for liaisoning with your managed care plans, with the Department of Aging. So guys, please don't stop.
Great. And Jason, Lydia again, thank you, Nancy, for that match of my donation. I think the other thing that maybe hasn't been said as strongly, Jason, relative to membership, and I know Christina would echo this, she had to leave our meeting a little bit, is that when legislators or other policymakers ask, well, how many people does CADS represent? We always say we're representing 40,000 participants and their caregivers. Actually more than that. But when it comes to how many centers do we represent, we have to be representing at least 50% of the community out there of centers. And today we can't say that. We can't say that. And that shows that we are not as strong as we need to be. So I would just make a pitch as the former executive for CADS, making this, this plea for many, many years. This is the time. And if people want all of these goals to be achieved over the next few years, we have a fantastic team. We got to keep them going. And this is the time to really step up and join CADS and be part of the community. So thank you, Jason, for those words. And I'll sign off now. I think we've got another pledge. Chai-Ling from Sunflower, thank you. And Silicon Valley Adult Day Health, another $1,000. Eva, thank you so much. Okay, I think with that, we're ready to sign off. We're going to give you guys just another minute. Silicon Valley, we already noted. Sunflower. This is your last chance to make a pledge, and then I know CADS will be hounding you all for donations over the coming weeks to keep the momentum going. All right, so Renee, you want to sign us off for today and wish everyone good luck to us all. So thanks for being here, everybody, from me.
Thank you guys, much appreciated. Again, don't let the donations stop. I was about to auction off my dog, 2 of them, one large and small. So keep on going, stay with us, get involved in all your advocacy, get involved with CADS, so you have a voice and your messages are part of these messages. So thank you guys.